the agenda for today. So we have Kimberly De Caltago. I messed that up earlier, but she'll be presenting with our CSM, Julia Walensky, and they will be discussing how VA New Jersey East Orange has increased medication teaching SHEP scores, medication sheets viewed, and their medication sheets acknowledged with Get Well. And then we will move into Lisa Miller discussing how Get Well implementation process worked for VA Amarillo. And with that, I will let Julia and Kim take it away.
Thank you, Nina. So again, my name's Julia Walensky, and I'm the Client Success Manager here at VA New Jersey.
And my name is Kim DiCataldo. I work in our Office of Patient-Centered Care and Employee Engagement. And our office, we kind of help to co-lead with Julia all the efforts with Get Well. And we're really excited today to share about the exciting things that have been going on since Julia joined us as a full-time Client Success Manager. Here at VA New Jersey, we have two main campuses. The East Orange campus has our medical beds. We have about 90 med-surg beds, and Get Well Network is currently deployed in 5 of those bed unit areas. At the Lions campus, we have our community living center, and that's where we utilize Get Well Network. And in March of last year, Julia joined us as a full-time CSM, and we were really excited to be able to kind of better utilize Get Well Network with our residents and our patients here, and to allow them to have a better patient experience while in the hospital. So I'll turn it over to Julia.
Thanks, Kim. So VA New Jersey really wanted to improve their overall utilization of Get Well at their facilities. So in order to accomplish this, they decided to get a dedicated client success manager, which is me, who would be going on site every day. When I began coming on site it was March of 2024, they wanted a main focus of mine to be rounding with the veterans, orienting them to the Get Well system, and particularly focusing on medication teaching. So you can go to the next slide. So in addition to daily rounding with the veterans, I conducted medical resident in-services on Get Well medication teaching. For many of them, this was their first encounter with Get Well. So it was really important to tell them about all the features and things that were available to them. We also began unit staff refresher training on the Get Well system for not only the nurses, but also MSAs who are like the unit clerks, nursing assistants, and housekeeping staff. These are all staff members who frequently interact with veterans and get a lot of questions about Get Well. So they needed to be up to date on what is offered more than just how to get to cable. I began a Get Well new nurse orientation training. So all of these actions I just discussed began in February, like March of 2024, and they didn't just stop that month. These continue daily, on a regular basis. And it's very important to make sure that the staff remain up to date and the veterans are getting the best use out of the system. So finally, the medication teaching acknowledgement was activated by Get Well in April of 2024. When a veteran is viewing a prescribed medication and they try to leave the page, they are prompted either like if they understand the medication or they need to continue reading about it, or they could say they will return later. When they select, yes, I understand this medication, it actually automatically documents it to CPRS. So that's one less thing the nurse has to document, which is incredible. And you can see what it looks like for aluminum hydroxide. This is just the test page for what the veterans see. And this feature, again, was activated in April of 2024, and it was previously only active for like high alert medications, like mostly opioids. So, but now it's every single medication that they are prescribed. So this is the exciting stuff. So this graph shows quarterly the number of medication sheets viewed by veterans, the number of medication sheets acknowledged by veterans, and excitingly, the SHEP top box score for medication communication. So just as a reminder, I began going on site daily in FY24 in Q2, but looking back, starting in FY23 Q2 to FY24 Q4, there was a 40% increase in medication communication top box score. There was a 76% increase in medication sheets viewed by the veterans. And there was a 622% increase in medication sheets acknowledged. From speaking with the veterans and the staff, I've learned that a lot of them did not really know about the medication features of Get Well until I began educating them on it. And everyone that I've spoken to thinks it's very positive for the veterans and also their loved ones. I've had a lot of veterans who their family members are very worried about their care and may not be able to be there with them. So really appreciate they can actually send this information to them. So it's really helps the loved ones as well. This opens up really great conversations for the veterans with their nurses, like, why are they taking X medication? What about Y side effect? Like, what frequency am I taking this medication? It really allows them to feel more informed and empowered about their care. Any questions?
Carl, do we have any questions in the chat at the moment?
Nope, I don't see anything. And just as a reminder, folks, if you would like to ask a question down at the bottom of your screen, you should see the option there. Be able to click in and you can ask a question anytime during the presentation, and then we'll cover it towards the end. So if you haven't had a chance to ask any questions yet of Julia or Kim, feel free to go ahead and put them in, and then we'll just get them at the end of the webinar. And as I was speaking, we have one that just came in from Daniel Hawkins. Is this utilized in an outpatient setting, and if so, how?
So it is not, we are not in the cloud, so it is not utilized in outpatient settings. It's connected to the veteran CPRS charts, and they're not able to do that in outpatient settings at this time.
We currently have 5 medical bed areas that we utilize Get Well Network in the inpatient area, and that's where Julia has been really focusing these efforts for her med teaching rounding.
And I see another question from Rebecca about the pharmacist. So yes, I did do in-services. That was the refresher trainings also did include pharmacists, even though I did not mention that, I'm sorry. I did go to the pharmacy and actually I sent out a recorded, I recorded myself giving the in-service as well and sent that out to them. So that any new pharmacists that come on board either can, come to me, or they could just be sent that in service. So yes, I did educate the pharmacists. There is an option on medication teaching where there's a question mark. So if the veteran selects the question mark, it will send an email alert to a pharmacy email distribution group. And it's based on the unit. So that the pharmacists and the nursing staff could follow up with the veteran on any questions that they have about a particular medication.
And I think just to kind of maybe, end or close out, it's one of the main parts that started Julia started doing when she was here was kind of reorienting all of our staff and our residents and our patients using Get Well to make sure that everyone knows how to best utilize the system. If they have any questions, they know who Julia is, how to access her, how to connect with her, to make sure that everyone's using the system the best that they can and really using all of its amazing capabilities. So we're very grateful to have her here joining us now.
Thanks, Kim. They call me the TV lady.
We love it. Awesome. If there are no other questions at this time, I just want to say thank you to Kim and Julia. That was a wonderful presentation. Really appreciate it. And this slide deck will be available if you fill out the post-webinar survey and you select that you would like to receive the slide deck and follow-up. I will happily share this, and Kim and Julia have both agreed that if you have any questions, you can route them to both of them. And with that, we will move forward on to Lisa's presentation.
I'm not sure. Can you hear me?
Yes.
Okay, very good. All right, my name is Lisa. I am actually the acting nurse manager for Med-Surg now, so sorry I didn't change that. Things change. All right, so I just want to talk about how we implemented Go Live in Amarillo's VA. So we are located in Amarillo. We're a 189-bed facility. We have a 14-bed ICU, 25 beds in Med-Surg, and then 120-bed CLC. So we are currently deployed with Get Well in our community living center, in CLC, all of CLC, which is CLC A, CLC B, and Welcome Home, and the hospice unit. We have day surgery, endo, and chemo. Also, we went live there, and in the acute care facilities. So improving the veteran experience with digital tools through implementing Get Well, the opportunity was to improve the veteran patient experience through digital engagement interfaces. The solution is implementation of Get Well, and it's really been a benefit for us. And we did this in our clinical areas, as I just discussed. Looking forward, what we'd like to do, and in hindsight, we really wish we had put it in the ED to begin with, but the long-term goal is that we add Get Well to the ED and the clinics, so the PACT and the CBOX. I think it could really benefit them as well. With our Go Live, Get Well definitely gives you all the resources, you know, when you're trying to figure out how to navigate this, because it's actually a big program to implement and it touches all services. So it's not just an easy, you know, nursing use. It's more than just nursing doing this. So their tools helped, I think, us be successful with our implementation and trying to get your head around how to make it successful. So the trifecta that they've given us for the trifecta for success, the way we started was with our executive leadership. So we began building the team by attending meetings. We went to, just to give a high level introduction of Get Well, so everyone's aware of what it's capable of. We had it in the past, but I think the new platform is so much more user-friendly and more impactful from the veteran experience perspective. So we attended the medical provider morning huddle. We participated actually in one-on-one meetings with the nurse exec and the nursing leadership team. We attended the ADPCS huddle, and I'm still doing that. I'm sorry. Let's see, each of the executive sponsors Get Well weekly meetings. So with this lowest level, would you go back to the previous slide? There we go. So with that executive sponsor, we got the executive team on board early. And then the program managers, the way we tackle that is early in the planning. We scheduled meetings with the leadership of the different disciplines so that we can increase their understanding of the platform. With that, we included the clinical informatics leader, the clinical educators, and the veteran experience leaders as part of that group so that we could introduce it. We did a demo of a content build at that point so we could receive input from this group, the multidisciplinary group. And it was at this point that I feel like the light bulb started coming on, that it's like, oh wait, this isn't the old Get Well. This is actually well improved, new and improved. And then it started kind of generating this excitement, and people started getting really interested in the platform and what it could offer our veterans and our staff. I mean, it really is a multifaceted platform. At this point, right here with the program managers, we got the clinical educators that became actively involved in planning the Go Live process. And then that top tier, the Get Well champions, we solicited about maybe 1 to 2 months prior to our actual Go Live. We asked each discipline to designate champions. So we had at least one staff member per shift, per unit as a champion. And we also had from each department. So the ancillary team, we got somebody from each of the ancillary teams. And this is how our trifecta was built. Okay, next slide. I was jumping ahead of myself, sorry. All right. So building the multidisciplinary excitement and understanding of the technology. Again, I think this was a whole lot about the pre-work that we did and just getting the information out there. So building the team began with attending the meetings, very high-level introduction of Get Well. We attended the medical provider morning huddles. We participated on one-on-one meetings. attended the ADPCS huddle so that everyone's just hearing this over and over. It's coming. This is what it has to offer. And we didn't go into a lot of detail at this point, just making sure that people are aware that it's new and improved and it's coming back to us. Let's see. And I think that helped us build the group of champions much easier because people had been hearing about it. And there was a lot, I guess, a high level knowledge, but a little bit of an excitement going on at this point. So we had just getting the champions, we ended up with 31 that championed our Get Well Go Live, and they're available past Go Live. You know, these are the people that are going to keep teaching the new people and keep it alive and well at our facility. So we had 31 champions. They came from nursing, endo, respiratory, food nutrition, quality, pharmacy, chaplain services, and patient experience. And then the comprehensive training plan. I put these 2 forms up there just because I wanted to show Get Well supports you so much through your implementation phase. You know, you're thinking about how am I going to advertise this so everyone knows it's coming. And instead of me having to build it, it was already built. So it was really, really easy. They sent it to me in advance and all I had to do was print it. But you can see the QR codes on that one poster to the right. So they scan that and it takes them to a link where they can actually watch the video. And we required that our staff do this before they come to the Go Live. So they learn about it before they actually come to the Go Live training. So they're already ready to have questions and to understand it and just be more prepared to ask. And all right, I guess that's it on that slide. So then comes the champion training. So the virtual champion training was done a month prior to Go Live, and this helped build more excitement. You know, they've already kind of been introduced to it, and then we actually showed them this is the content that we've developed for Amarillo. And we worked with all the disciplines to develop the content that we thought would be most meaningful for us. So we've done that pre-work. The virtual champions did their training about a month before, and then the in-person training was really, really nice for our champions. That was the first day of the 3 days that Get Well was actually on site. So that was January 28th. This same day, we did training with all of our champions, and we did a tabling outside the canteen where we just set up outside the canteen and had giveaways and really nice posters and had a really pretty table we presented. So when people walk by, it's another introduction and gave us a chance to talk to really anyone that walked by. The visitors had questions, you know, the staff, patients, anyone that walked by could stop and ask us questions. Again, using the tools that they gave us. This tool to the left is our champions that we had, but it also let me use it as a tool throughout the training process. And I guess I keep putting the tools they gave us in just to let you see how easy they make it for you. We use this to even order the t-shirts because the champions all get t-shirts. So I would just use this tool and put the size of t-shirt, and then I was able to easily send it back to Get Well so they could get the t-shirts ordered. And then they sent those to me it was about a week before Go Live that I had everybody's t-shirt ready for them. So when they came to training, their t-shirt was ready. They also, any of the training tools that we use, they had sent those to me about 2 weeks before. All of the giveaways that we had for the tabling, all of that was already sent to me. So before they ever get there, I have everything I need to make the Go Live successful. So during the training for the champions, t-shirts are there. We do the training in a classroom, and they were able to actually, we had a big monitor, so we're able to go through the platform in classroom and then go to bedside and see what it looks like. So we had the classes for the champions, and then we did a, let's see here, sorry. Let's go ahead and go to the next slide for the end user training. So we had, the training sessions lasted about 20 to 30 minutes, depending on how interactive the team was that came. But you can see the schedule that we set up. And again, this is a tool they sent me, so I didn't have to reinvent anything. But they came day shift and night shift for 2 days. And we had the champions that we had trained the day before there to facilitate it. They wore their t-shirts to actually designate them as one of the champions. We actually completed 85 trainings during those 2 days. with, I mean, not 85 trainings. We trained 85 nursing staff during those 2 days. The beauty of having the champions is they continue to go back and catch those that weren't able to attend one of the trainings and get them trained with the goal of having everyone have that initial competency completed. Ongoing, when a new employee comes on, it's on their orientation checklist. So we make sure that they know the platform and what it's capable of so that we can keep it alive and well. I think that's it. Any questions?
So there's one question, Lisa. As far as training, did you find it more beneficial to conduct training in an empty patient room versus classroom, or vice versa?
I think both. So with the champions, we did empty classroom and a patient room. And I'm glad you said that because I didn't make it clear that the end user training was all done in a patient room. So we were actually at bedside and we're able to use the platform and go through it, you know, take our time, look at every piece of it. So yeah, we did both. And I think the hands-on to me is always the most beneficial. But with the champions, we did both so they could see all of it.
And then there's
Awesome.
a comment in the webinar chat. Get Well Network has been a great benefit for immediate service recovery, and given us the opportunity to re-educate some of the veterans if needed. So do you have any examples that you can share around how you're leveraging Get Well for service recovery?
Yes, absolutely. And I think that is such a great benefit. One of the things that Amarillo is working on, we haven't completely done it yet, but the emails that you receive, they actually go to the service that is most affected by whatever the feedback the veteran has. So if they are having issues with nursing care, it's going to come to me. So that gives me a chance to immediately go out there and more real time go out and say, okay, so what's going on and what can I do to help? And let's make this right. You know, it gives you that chance to do right by the veteran immediately. If it's chaplain services and they need somebody at bedside, that gives them the chance to get out there. Not even that they're having a problem with the service, but they need something from them. It gives the chaplain a chance to get at bedside very quickly because the email is immediately going to go to that service. But what Amarillo is trying to work on is getting an email group that all of them go to. So anything from Get Well is going to go to this group. So there's a lot of eyes on it. So you don't ever have a missed opportunity. So say Lisa Miller's out of the office, if that came to me, it might be not seen until I come back the next day. But if it goes to a group, somebody else is able to intervene more quickly if I'm not here. But anyway, we're working on that and there's more to come. We'll let you know when that goes through.
All right, awesome. I don't see any other questions listed here. So thank you very much, Lisa.
Absolutely. Thank you.
Yes, thank you so much, Lisa. Great presentation. And same goes for Lisa as the last presentation. If you'd like to reach out to her, she has agreed to reaching out directly to her. If you're interested in getting this slide deck so you can get her contact information after the fact, please just let us know in this post-webinar survey. But that completes our community of practice. And just as a quick reminder for our clients and prospects, we have a Get Connected conference happening in May. It'll be the 1st and the 2nd. If you're interested in getting more information about this conference, we would love to share more with you. This is a very exciting event, and this is the first time we've done it since the big COVID issue. So we're really excited to reintegrate this into our workflows. Please just let us know if you're interested in learning more about this in the post-webinar survey. And I just want to say thank you to everyone. Thank you to our presenters for your wonderful presentations. And thank you to everyone who has taken some time out of your day to attend this webinar.